In this presentation, we will go over the basics behind memory loss. We will discuss the process for diagnosing a dementia, as well as the different kinds of dementia that exist. The objectives of this presentation will be to review the early signs of dementia and what to look for to get tested, to discuss the different types of dementia, to discuss the process for diagnosing dementia, and discuss current treatments for dementia. First, what is dementia? Dementia, also known as major neurocognitive disorder in medical terms, is a loss of thinking ability that affects a person's ability to care for themselves independently. Symptoms of decreased thinking ability include loss of speech, memory loss, poor judgment, difficulty interacting with others, and/or loss of motor skills. The symptoms of dementia typically worsen with time and are not reversible. What are the warning signs to seek an evaluation for dementia? Frequently getting lost or disoriented, frequently forgetting recent events or conversations, having difficulty speaking due to forgetting the names of objects or forgetting words, drastic changes in personality or behavior, and finally an inability to perform everyday tasks that were once performed well, such as driving, cooking, managing finances, and managing medications. How is dementia diagnosed? There are several ways a doctor can go about diagnosing a dementia. After doing a clinical exam, the physician may do all or some of these tests. Number 1 is lab work, number 2, brain imaging, and number 3, memory testing. The following slides will go into these tests in more detail. The clinical exam. During an initial clinical exam for dementia, the physician will likely ask questions about when the symptoms of dementia began, what losses in functioning you have noticed, and how quickly you have noted the loss of functioning to be occurring. The physician will also ask about past and current medical history, medications your loved one is taking, any family history of dementia, history of drug or alcohol use, and sexual history. Physicians will also do a physical exam, particularly a neurological exam, to evaluate for any losses in mobility or motor skill. Lab work. Here are some of the common types of blood work that your doctor may order to evaluate for dementia. A CBC or complete blood count, a CMP, a complete metabolic profile, a B12 vitamin level, a thyroid panel, a urine analysis and urine culture, HIV testing, syphilis testing, genetic testing, especially if there are significant family history of dementia or if the dementia has occurred at a very young age. Brain imaging. Your physician may order an MRI, magnetic resonance imaging, in order to get a better look at the brain to see what could be causing a dementia to occur. Here are some frequently asked questions about MRIs. What is an MRI? An MRI is a type of brain imaging that uses a machine with a high-powered magnet to take pictures of the brain. The magnet in the machine creates waves in brain tissue that are detected by the machine's detector to create a picture. How long does it take? MRIs typically take 30 to 45 minutes. The best picture is created if your loved one can lie still the entire test. If this is not possible, you may have to ask the doctor to order a sedative to be given during the procedure. If claustrophobia is a problem, an open MRI is an option in some hospitals. Does the procedure cause any pain? No pain is expected. If your doctor orders an MRI with a contrast agent, however, an IV may need to be temporarily placed during the procedure. What are some other safety concerns that I should be aware of? Please let your doctor know if your loved one has any metal implants, metal-containing tattoos or body art, or implanted devices like a pacemaker, spinal stimulator, deep brain stimulator, or vagus nerve stimulator, as they will need to be sure that these items would be safe in an MRI. This slide contains an example of a typical MRI that would be in a hospital setting. Memory testing. There are two kinds of memory testing that could be performed. Number one are screening exams. These exams are typically performed in the doctor's office and take about 10 minutes. These exams are a good way to see if there are really any concerning memory problems. These tests will look at basic memory functions like naming items, performing simple calculations, short-term recall, ability to read, write, and follow complex commands, and basic orientation to time, date, and place. The Mini Mental Status Exam and Montreal Cognitive Assessment are two tests commonly used in offices to screen for dementia. Number two is neuropsychological testing. This type of testing usually occurs in a special clinic that the doctor will make a referral for. These tests not only identify whether there is a dementia, but can also narrow down what kind of dementia is present. They can also tell us what functional deficits are present, like ability to drive, manage medications, or manage finances. These tests usually take anywhere from 3 to 4 hours. These tests are the most comprehensive memory tests and usually involve the patient taking several tests that examine different parts of memory. Now that we've gone over the evaluation for dementia, let's discuss the kinds of dementia. Several different kinds of dementia do exist. Your loved one may have one or a mixed dementia made of a combination of causes. Below is a list of the common causes of dementia. Please remember to always make sure you have spoken with a physician to get the most accurate diagnosis of dementia. Number one is Alzheimer's disease. 2, vascular dementia. 3, frontotemporal dementia. 4, Lewy body dementia. 5, dementia due to traumatic brain injury. And 6, dementia due to another medical condition. The following slides will discuss these different types of dementia in more detail. Alzheimer's disease. This is the most commonly diagnosed type of dementia. This dementia is characterized by abnormal proteins called beta amyloid and neurofibrillary tangles that cause damage to the brain. The sides of the brain, also known as the temporal and parietal lobes, are usually affected first, which means the person will often show signs of short-term memory loss, forgetting the names of common objects, not recognizing familiar people, and becoming disoriented in familiar places. Alzheimer's disease usually leads to death in about 10 years, though this can vary significantly from person to person. There are forms of Alzheimer's disease that run in families. Talk with your physician if you're interested in this type of genetic testing. Vascular dementia. Dementia caused by disease to vessels in the brain or stroke is a vascular dementia. Common risk factors for vascular dementia are untreated high blood pressure, high cholesterol, diabetes, and heart rhythm problems like atrial fibrillation. Symptoms of this dementia vary depending on what areas of the brain are affected. The decline in memory seen in vascular dementia is often considered stepwise because symptoms can be stable for some time before declining again. Controlling the risk factors mentioned above can slow down the decline due to vascular dementia. Frontotemporal dementia. This dementia affects the frontal lobes, and sides, temporal lobes of the brain, which means there can be problems with executive functioning, such as planning and organizing things, decision-making, personality and mood changes, language changes, as well as memory problems. There are different forms of this dementia. The behavioral variant form presents with personality changes, more impulsive behaviors, and a decline in memory typically. The language variant form presents with significant forgetting of words and speech that is broken up or non-fluent. There are also genetic forms of this dementia, and this dementia often presents at a younger age than the other dementias. Lewy body dementia. This type of dementia has symptoms of Parkinson's disease, such as tremor and difficulty walking. Patients with this form of dementia will often have vivid visual hallucinations and difficulty with visuospatial functioning, seen by difficulty with drawing or writing. This type of dementia will affect deep brain structures, and proteins known as tau tangles will also be present in the brain. Individuals with this dementia can also have fluctuating levels of cognition and alertness, which means that someone may have better memory on some days than others. They can also look very fatigued and confused for several days in a row, then suddenly improve. Dementia due to traumatic brain injury, TBI. This dementia is usually from a moderate to severe head injury, not just a simple concussion. This type of dementia can affect different areas of the brain, depending on where the damage from the traumatic brain injury, TBI, occurred. This type of dementia presents with symptoms that vary between each patient based on where the damage from the TBI occurred. You may notice short-term memory problems, poor memory for events after the accident but not from before, problems with movement, mood disorders, and personality changes. Dementia due to another medical condition. These are dementias that develop as a result of another illness. When someone develops a dementia from one of these illnesses, the severity can vary from person to person. Some people may not develop a significant dementia from these illnesses. The illnesses that can cause a dementia are listed below. Number 1, Parkinson's disease. Number 2, normal pressure hydrocephalus. 3, HIV/AIDS. 4, syphilis. 5, excessive alcohol use. Depression can often cause what we call a pseudodementia because it is not a true dementia, as it is reversible if the depression is treated. If your loved one is showing signs of depression, such as frequently low mood, irritability, difficulty sleeping, anxiety, or withdrawing from friends, family, or hobbies, it is worthwhile to make sure that memory problems are not actually due to depression. Depression can cause difficulty focusing and concentrating, which can make it difficult for a person to form memories in the first place, so they can seem more forgetful. Apathy or lack of motivation from depression may make it seem like your loved one is not able to take care of themselves. Depression is a reversible cause of memory problems, and treating depression can really improve your loved one's quality of life. So it is important to make sure that this is properly addressed before a diagnosis of dementia is made. What are the treatments available for dementia? The treatments for dementia can vary depending on the kind of dementia and how severe the dementia is. Here are some treatments your doctor may speak about with you and your loved one. Number 1, managing vascular risk factors. Number 2, medications specifically for dementia. Number 3, physical therapy, occupational therapy, and speech therapy. The following slides will go over these treatments in more detail. Managing vascular risk factors. The doctor may want to make sure your loved one is minimizing risk for further damage to the brain and its blood supply. They may suggest the following to minimize this risk. Number 1, controlling blood pressure. Number 2, prescribing medications to treat high cholesterol. Number 3, controlling high blood sugar. Number 4, starting medication to treat heart conditions like atrial fibrillation or clotting disorders. And number 5, quitting smoking. All these factors above can cause more damage to the brain if they are not properly managed. Medications for dementia. There are 2 classes of medications that are options to slow down the progression of dementia, but they are not a cure. First are acetylcholinesterase inhibitors. These medications increase the amount of a brain chemical that is felt to be important in the formation of memory. Next are NMDA receptor antagonists. These medications decrease damage to the brain by protecting the neurons that make up the brain. There is currently still active research going into finding a cure for dementia. You may see some of these studies on the internet. There are also many ads for vitamins, supplements, and drinks that claim to treat dementia. However, the two classes of medication discussed above so far are the only Food and Drug Administration, FDA, approved medications for dementia in the United States. Physical therapy, occupational therapy, and speech therapy. Your loved one may already be having problems with walking, speaking, or having difficulty with tasks that require fine motor movement like dressing or bathing themselves. Physical therapy can be used to improve mobility. Occupational therapy can help with difficulties in performing tasks like dressing themselves or feeding themselves. Speech therapy can aid in any communication problems or swallowing difficulties that are present. Please let your doctor know if you feel any of these services are needed, as they can help prolong time for further independence in the home. In summary, there are many different causes of dementia. One person can have one cause or multiple causes. Drastic changes in personality or ability to live independently are concerning symptoms for dementia and should be mentioned to your loved one's doctor so they can be evaluated. After a clinical exam, doctors will order lab work, brain imaging, or memory testing to help diagnose the dementia. What a doctor decides to order varies from person to person, depending on their presentation. Once a diagnosis is made, your doctor may prescribe medications to decrease the risk of further injury to the brain, or may start medications that can slow down memory decline. Different kinds of therapy are also available to improve your loved one's ability to function independently. This concludes our presentation on diagnosing and evaluating dementia, the different kinds of dementia, and the current management and treatments for dementia.